Hello everyone, my name is Jennifer Rodriguez and this presentation is going to be about penile cancer. What is penile cancer? Penile cancer develops in or on the penis. Cancer starts when cells begin to grow out of control. Cells in nearly any part of the body can become cancer and can spread to other areas in the body. How does it look like? This is just a simple graphic showing how a penile cancerous penis looks like. There were other pictures I could have posted, but they were very graphic, and I feel like we didn't have to see that. It's just an example. So, signs and symptoms of penile cancer. The signs and symptoms posted below don't always mean a man has penile cancer. If you have any of these signs or symptoms, see your doctor right away so the cause can be found and treated if needed. The sooner a diagnosis is made, the sooner you can start treatment and the more effective it is likely to be. Some signs and symptoms of penile cancer is skin changes. Most often, the first sign of penile cancer is change in the skin of the penis. This is most likely to be on the glans, tip of the penis, or on the foreskin in uncircumcised men, but it can also be on the shaft. Possible signs of penile cancer include an area of skin becoming thicker and or changing color, a lump on the penis, an ulcer or sore that might bleed, a reddish velvety rash, small crusty bumps, flat bluish brown growths, smelly discharge or fluid under the foreskin. Sores or lumps from penile cancer are not usually painful, but they can be in some cases. You should see a doctor if you find any kind of new growth or other abnormality on your penis, even if it is not painful. Another sign is swelling. Swelling at the end of the penis, especially when the foreskin is constricted, is another possible sign of penile cancer. There's also a sign of lumps under the skin in the groin area. If the cancer spreads from the penis, it most often travels first to lymph nodes in the groin. This makes those lymph nodes swell. Lymph nodes are collections of the immune system cells. Normally they are bean-sized and can barely be felt at all. If they are swollen, the lymph nodes may be felt as lumps under the skin. Sometimes men with penile cancer do not show any of the symptoms, or these symptoms may be caused by a medical condition that is not cancer. If you are concerned about one or more of the symptoms or signs on this list, please talk with your doctor. Your doctor will ask how long and how often you've been experiencing the symptoms, in addition to other questions. Are there any risk factors? Yes, there is. A risk factor is anything that increases a man's chance of developing cancer. Although risk factors often influence the development of cancer, most do not directly cause cancer. Some people with several risk factors never develop cancer, while others with no known risk factors do. However, knowing your risk factors and talking about them with your doctor will help you make more informed decisions about your healthcare choices. The following factor is an increase in the person's risk of developing penile cancer, such as a human papillomavirus infection known as HPV. This is the most important risk factor for penile cancer, which is an infection within this virus. HPV is most commonly passed from person to person during sexual activity. There are different types of strains of HPV, and some strains are more strongly. You can reduce your risk of HPV infection by limiting your number of sex partners, because having many partners increases the risk of HPV infection. Using a condom cannot fully protect you from HPV during sex. HPV vaccines protect against specific strains of the virus. Smoking. Smoking might contribute to the development of penile cancer, especially in men who are also infected with HPV. Age. Penile cancer is most common in men older than 50. About 20% of men diagnosed with penile cancer are younger than 40. Smegma. Smegma is a thick substance that can build up under the foreskin and is caused by dead skin cells, bacteria, and other oily secretions from the skin. Smegma may contain small amounts of cancer-causing substances. Uncircumcised men should pull back or retract the foreskin and thoroughly wash the penis on a regular basis to make sure that smegma does not cause irritation of the penis. Phimosis. Phimosis occurs when the foreskin becomes tight or constricted and is difficult to retract, therefore causing a buildup of smegma. Men with phimosis are less likely to be able to thoroughly clean the penis. HIV and AIDS. Infection with human immunodeficiency virus, the virus that causes acquired immune deficiency syndrome, is a risk factor for penile cancer. When a person is HIV positive, their immune system is less able to fight off early stage cancer. And lastly, psoriasis treatment. Men who have received the drug psoralen combined with ultraviolet light have a higher risk of developing penile cancer. Is there prevention? Yes, there is. Research continues to look into what factors causes this type of cancer and what men can do to lower their personal risk. There is no proven way to completely prevent this disease, but there are steps you can take to lower your cancer risk. The first option is circumcision. Circumcision may provide some protection from penile cancer because removing the foreskin helps keep the area clean. Epidermoid cell carcinoma of the penis almost never occurs in men who are circumcised. However, it is important to note that circumcision alone cannot prevent penile cancer. The second factor is personal hygiene. Men who carefully and completely clean under the foreskin on a regular basis can lower their risk of developing penile cancer. HIV and AIDS infection can lower your risk of your penile cancer. You should talk with your doctor if you have concerns about your personal risk of developing penile cancer. Here are a few key statistics about penile cancer. This year, there was an estimation of 1,820 men in the United States that will be diagnosed with penile cancer. And out of those, 310 men will die from the disease. Penile cancer is rare in the United States and makes up less than 1% of all cancer diagnosed in men. It is more common in some parts of Asia, Africa, and South America, where it accounts for up to 10% of cancers in men. If you have penile cancer, what now? Are there any treatments? Yes, there is. The treatments allowed are possible surgery, laser therapy, radiation therapy, chemotherapy. There's various types of surgery like Mohs surgery. This is a technique where they remove the cancer that can be seen or the surface of the penis, in addition to a small amount of normal tissue around the edge to make sure that no cancer is left behind. We also have laser therapy, which is the use of a very powerful beam of light to kill cancer cells. We have radiation therapy, which is the use of high-energy X-rays or other particles to destroy cancer cells. Chemotherapy is the use of drugs to destroy cancer cells, usually by stopping the cancer cell's ability to grow and divide. Here are my resources used for this research project. I hope that you have learned a little bit more about what penile cancer is. Please make sure you get yourself tested, be monogamous, and take care of yourselves. Thank you.